Hi and hello to this podcast in which we will describe the blue and black rule for the management of melanocytic lesions showing a structureless blue pattern. The dermoscopic diagnosis of a given melanocytic lesion relies on the assessment of three main criteria: colors that allow us estimations about the location of melanin in the skin, morphologic patterns that allow us to identify different types of melanocytic neoplasms, and distribution of colors and patterns that allow us to differentiate between surely benign and potentially malignant skin tumors. If we look at the colors of melanocytic neoplasms, they are mainly due to melanin in different levels of the skin. While melanin in the epidermis, like in the stratum corneum or dermoepidermal junction, will give rise to black or brown color, melanin in the papillary dermis gives rise to gray color. Melanin in the deep parts of the dermis, like in the reticular dermis, gives rise to blue color. We know that a structureless blue pattern is the hallmark of blue nevi, but this pattern can be also sometimes seen in thick nodular melanoma. Now the question is there any way to differentiate between these two different entities? And there we have to understand the histopathologic differences between a blue nevus and a thick nodular melanoma. In a blue nevus, we will have melanin within melanocytes that is purely located in the dermis. There is no epidermal involvement. Instead, in a thick nodular melanoma, we have both dermal and epidermal involvement, whereby we have pagetoid spreading, epidermal thinning, and ulceration. And accordingly, we see in a blue nevus just structureless blue color, whereas in a melanoma, we have melanin in the dermis, but also in the stratum corneum, and therefore we have this color combination of blue and black, whereby we can usually see a structureless blue coloration that is associated with black dots, globules, or blotches. Some more examples: a blue nevus showing just structureless blue pattern. Instead, here we have a melanoma showing structureless blue pattern associated with black blotches and globules and dots. Another example of a blue nevus, we just see blue coloration. Instead, a nodular melanoma showing again structureless blue coloration, but again the association with black dots and structures. So to summarize, the blue and black rule is a simple clue to differentiate between blue nevi and nodular melanoma showing a structureless blue pattern, whereby blue nevi are blue and black negative and nodular melanoma is blue and black positive.